But my name's Henry, and I want to talk to you guys today about something that is most likely going to affect every single person in this room at some point or another in your career. So we have a lot of experience in this room with us. So it's after lunch, and let's go ahead and get moving. If you guys could all stand up for me. All right. So taking a look around the room, if you have ever calculated a drug incorrectly, administered the wrong medication, given a medication to the wrong patient, pulled the wrong stock bottle from a shelf, sent a medication home with the wrong owner. Go ahead and take a seat.
Yep.
So I think this pretty much proves my point. So it is extremely likely that any medical professional is going to experience a medication administration error. So why do medication errors occur? The nature of human error. We are all people, and at the end of the day, you can have every policy and procedure known to man, and because you are human, you are still likely to make an error at some point. High patient loads and demanding case volume, we know that quality of veterinary care is at the extreme in demand right now. And we also know that we have an extreme shortage of qualified technicians and assistants out there. You combine these two together, and we are extremely overworked. So it's really easy for us to get stressed out and miss some of the basics and make these errors. Distractions are extremely common. They go hand in hand with calculation errors, and medical math is a little bit beyond the scope of this lecture, but definitely know and be strong in your calculations. A lack of training and established protocols, this is a real big one. A lot of us just don't have time to put the time that we need into training. So we're getting people out on the floor that don't have the time that they needed. Look-alike and sound-alike medications, there's a lot of new drugs coming out on the market now, and especially when you start looking at drug classes, everything seems to look and sound alike nowadays. Miscommunication and blatant misunderstanding. And when can these medication errors occur? From the time a drug order is received until the time the medication is administered to the patient. There's a couple of critical points where errors are more likely to occur. When the initial drug order is given, this can be through a verbal miscommunication, calculating the drug dosage to be given, pulling the wrong drug from the stock shelf. A lot of us have really busy pharmacies with a lot of different drugs to choose from. Preparing the medication for administration, this could be drawing up parenteral medications, administration of the medication to the patient. This is where we have our route of administration errors. And documentation of medications that are to be administered. In this case, sometimes medications are just blatantly not documented that they were administered, or we have documented it incorrectly. So what can we as technicians do to lower the risk? And now, in order to answer that question, we're going to have to go back to some really basic stuff, something I hope everybody remembers from tech school, and that's the 6 rights of drug administration. So we've got the right patient. So we start out with verifying the proper patient in a couple of different ways. We can use disposable name callers. Every single patient in our hospital, when they're hospitalized, should always have disposable identification. The owner's collar is not adequate enough, so throw a quick collar on that patient. Gauge cards are great. They identify who the patient is and what they're doing in that hospital. It also serves as a checklist so that as we're completing treatments, we're able to sign on and verify that they've been completed. Up-to-date patient photographs in EMR. How many of you guys use photographs of your patients in their charts? Great. Now, how many of you guys have a picture of a 6-month-old puppy 3 years later in that chart? Okay. So one thing you can do is take advantage of that software. Update those pictures on a regular basis. It will really go pretty far to help you guys out. Documentation of unique markings, that black patch over the right eye, that can actually just serve as another way to stop and make you think that you're giving the right medication to your right patient. Team communication through rounding. I'm really kind of big on this one. Now granted, I work in a smaller practice, so it's a little bit easier, but everybody that's in that treatment room should know who the patients in your hospital are and what they're there for. Basic signalment, when treatments are going to be due. They don't need a full history, but just an idea of who's back there. Owner participation is a great way. We can get the owners to participate in identifying their own animals without even letting them realize it. You pick up the dog, you put him on the table, and you're like, all right, we're going to take Zoe, we're going to put a name tag on, give her a little extra bling, and then we're going to take her to the treatment room. Now, granted, the owner's going to hear that, but if you pick up Zoe, and this is actually Max, that owner's going to stop you. The right drug, we can ensure proper drug pulls by using written orders when applicable. This can kind of be a pain, but it can really save you guys a lot of time further down the line. Patient flow sheets are a really great option where CVMs can write their medication orders down so that we can avoid misinterpretation, especially when it comes time to things like BID versus TID dosing. Repeating verbal orders back to the DVM. So going back to that human error, despite what we all believe, veterinarians are humans as well. And a lot of times, just repeating that order back to them can make them stop and think. So we're checking them, they're checking us. It's a give and take relationship. Be aware of look-alike and sound-alike drugs. So here we have 3 completely different medications. They all do different things, and they can all be easily grabbed in the wrong manner. So metronidazole, methocarbamol, methimazole, that can be really easily misinterpreted, especially with a verbal order. Know your hospital formulary. Know which drugs you guys have in your hospitals. Know how they're supplied, what their concentrations are, general indications for usage. Taking some time to create a hospital formulary can be put in a 3-ring binder and kept in your pharmacy for quick reference in the future is a great way to be aware of what you're using, what you're giving, and how to use it. Avoid shortcuts with verbal orders. Is this so familiar to anybody? All right, so we've all danced the Dex dance. We've all gotten that order to give Dex. So use the full name of the drug when you're using verbal orders. This is another common one with Pred. So are we giving prednisone or prednisolone? Label all syringes immediately upon drying. Draw it from the stockpile, put a label on it right away. You can speed this up by having a full sheet of labels for each injectable medication in your hospital. Throw that in that binder in your formulary and keep it ready for quick and easy use. The right dose. So when prepping medications, maintain a clean workspace when you're preparing your drugs. I don't know about you guys, but I work better when things are clean, neat, and organized, and that's just my obsessive mind. Minimize distractions in any way possible. So what a couple of hospitals have done, and these hospitals have a high incidence of medication administration errors, they've created quiet zones. So in this hospital pharmacy, you've got a blue line on the floor when the technician is preparing medications for administration. They're within that box. They're not to be disturbed. They're not to be interrupted. No questions. They're to be ignored completely. Now this can take a little bit of time to implement this policy, and you may come back there and find your entire staff huddled in that box. That will require a little bit of revision, but it can really reduce the likelihood of medication errors. Avoid multitasking during preparation. As technical support staff, we are professionals at multitasking. And this is just one area where I definitely highly advise against it. Double check all your calculations. Again, calculation errors are the #1 cause of medication administration errors. Double check your concentrations and strengths on your stock bottles. We have a lot of different medications, a lot of different strengths. It can be really easy to pull the wrong one pretty quickly, especially when working with percentages. Work systematically. So before I got into veterinary medicine, when I worked as an AV technician at a teaching hospital, we had an established protocol that we would use. And this is a very basic version of it. But when we were working in the hood, we would always lay out our stockpiles, and we worked in a left to right mentality. And we always labeled our syringes and laid the syringe directly to the right of the vial that we pulled from. This became really critical, especially when we were mixing TPMs, and we could have anywhere from 15 to 30 syringes of parental medications that were being added to a stock bag. This just kept things organized. We always did this in the same way, the same manner every single time, and it greatly reduced the likelihood that we were going to get lost in our flow. Be familiar with the drugs that you're working with. Just know their unique properties. Know their basic routes of administration. Know which IV fluids they're compatible with. That's all they want. And watch for decimal points and units of measurement. Micrograms versus milligrams. Always use those preceding zeros, and those can really prevent some pretty disastrous consequences. The right route, always verify the route of administration of the original medication order, and never assume a drug's ROA, always confirm. I have had some pretty crazy orders to give medications over the course of the years, so you never ultimately know. Label all of your patient tubes and lines to avoid inadvertent ROA errors. So you've got this patient here, And let's say our patient has a triple lumen catheter, 2 peripheral lines, an arterial line, and an NG tube. So all of these lines should be labeled at their distal ports, and this can really make you stop, think, what are you administering and how is it typically administered? That'll prevent you from starting that TPN in a peripheral line or giving that clinic care through the jugular catheter. The right time and frequency, ensuring all on-time completed medical treatments can be accomplished through carrying a timer with you guys. This is great for antibiotic administration where peak plasma values are of extreme importance. Set that timer for an hour. Go about your business. Take care of your other patients. When that timer goes off, you can immediately run back to the treatment room and start that metronidazole CRI. Rounding with treatment staff, again, talk to the rest of your team. This doesn't mean them doing your treatments for you, but they can serve as another way to come and get you. Just remind you, hey, you need to do some treatments on that patient. Usage of electronic whiteboards, if you're lucky enough to have these are great, and I don't really need to even talk about that. Reduce frequency errors by using clinic-wide protocols for dosing terms. This is extremely important. Let's just talk about once daily dosing. We can use SID. I've also seen Q24H used. And in some hospitals, these are used interchangeably. By having a standard protocol hospital-wide, you guys can reduce miscommunication, misunderstanding, and written and verbal orders. Watch for sound-alike verbal orders. Again, BID versus BID is a big area where this can be a problem. And institute a double-check system for dispensed medications. This takes a little bit of extra time, some extra steps, but it has really reduced the likelihood of sending the wrong medications home with the client. So you get your medication order, you pull your stock bottle, you count your tablets, you prepare your label, and you set everything up like this. You call for verification, another technician will come over. They'll verify the order to the label, make sure the tablets in the bottle are the correct tablets. They'll initial, you'll initial, and then the bottle goes out the door. This takes some time, I won't lie, but it is critical to make sure these medications are being sent out properly. Review your medications to go home with your owners. Really, really review them and make sure they understand what the drugs they're giving their pets, what to expect, and how they're giving them. Utilize terms that are familiar with the owners. You would be surprised at how many owners actually can misinterpret orally. Use terms like by mouth, every 12 hours. Make it as easy as possible for them so that they can give their pet the care that they need. The right documentation, thorough, proper documentation can serve to prevent, identify, and rule out errors. Make sure you're documenting in the medical chart and on the cage card immediately after the drug is given. You know how quickly it can go off and you can get stuck doing something else and you forget to document something on the cage card. Somebody else comes along and sees that treatment goes due, they administer a drug, and now you've got a double dosage. So make sure you're writing that down right when it's done. Use generic names of medications in documentation. This is a big one. Those of you with referral practices, I'm sure you guys will appreciate this one. We want to see things like using Robitussin instead of Serenia. Generics are pretty much all across the board, so it's pretty much easier to understand and know what they're getting. Always record the dosage in milligrams or micrograms instead of drug volume. 2 cc's of Robitussin versus 20 milligrams, those types of things. Those will really help out the clients that you guys are sending them to. When medication errors do occur, notify the attending doctor. Own up to it. This establishes that level of trust with you, and this means that you care more about your patient than you care about yourself. Assess and treat the patient, document the error, notify the owner. Most important thing that I can get you guys to take out of this is debrief with all of the staff involved. Go back and look at that error and find out where the breakdown occurred. Was it clinic policy? Was it technician error? What can you do to change that and prevent that from happening again in the future? Going through all these steps, they're not going to stop medication errors from happening. However, we can greatly reduce the likelihood of this and increase the quality of our patient care. Any questions? Great.